So today I'm going to be going through, alongside my two guests, Zahra and Muskaan, how to answer your online interview questions efficiently. The basic premise of what we're going to be doing today is some tips from all three of us, just some general ones with dentistry, very basic overview of the types of questions, because in my last webinar we went more into depth with that, and the main focus will be a lot of collaboration and ensuring that everyone answers as many interview questions as possible, because at the end of the day interviews are coming up very soon, so I know you guys really want to practice, so I hope this is the best avenue to do so. So yeah, brilliant. Okay, I'm gonna give it to Zahra and Muskaan to take it away.
Hi everyone, so as you know, I'm Zahra, and we're just going to talk a little bit about our journeys, how we basically got to King's. So in the summer of year 12, I took some work experience. I did one at an NHS practice, one at a private, and they were both about a week long. And I know obviously it's going to be a little bit more difficult for some of you guys to get work experience, obviously with the current situation that we're in, but we'll go into more detail about that later on. In terms of my interviews, I had one panel at Queen Mary's, and then the rest were MMIs at King's, Bristol and Birmingham. And my UK CAT results, I had an average of about 740 and band 1 for situational judgment. And then I received all my interview offers.
Okay, thanks Zahra. Hi guys, I'm Muskaan and I'm a third-year dental student along with Faris and Zahra too. So my journey into dentistry, I did work experience in year 12 as well. So I did 2 weeks at a mixed practice and then 2 weeks abroad in Pakistan, where I got a complete different insight into dentistry. I also did some volunteering work. My interviews were at panel at Plymouth and MMI at King's, Birmingham and Cardiff, and I got my 4 out of 4 interview offers for those. My UK CAT results were 700 average and band 1.
Cool, thank you Zahra and Muskaan. So yeah, so guys, basically the reason why I've recruited these two members is because they're very knowledgeable. I can't think of any other better people to assist me today with this session and make sure that you guys really get the best out of this out of answering all these interview questions. So yeah, cool. So next slide. So very quickly, before we get into anything, I really do want you guys to contribute today. One of the big things that I took away from the last webinar was that I really had to force out of some people to get involved. I don't want that to happen today. I want you guys to really just free flow, get involved. It's a no judgment zone. We're just here today to try and get you to work together, try and get you to really improve your confidence and improve your interview skills. I am requesting, if you don't mind, if you can turn your cameras on. I don't mind if you want to just do it when you're answering the questions, but just having them on in general is just nice, so you can see who's here, get involved with them, etc. Another thing that I thought I'd mention is we do expect you guys to contribute at one point, because as I said, we don't want to just be the same 3-4 people answering the questions. We want to get as many people involved as possible. And yeah, and with regards to prompting, Zahra, what do you think? You had something to say?
So obviously we don't want it to be the same people every time, so we will try and prompt people that maybe aren't as confident to answer as well. But just bear in mind that, like Farah said, it is important that you guys turn your camera on when you're answering, just to stimulate the real interview environment as well. We might look at you really blankly, no expression, because some interviewers are genuinely trying to put you off by doing that. And as well, anything that we say, don't take it too personally, because it's really important, as a degree as well. I'm sure Muskaan and Faris can agree that you have to be able to take constructive criticism, even when you're on clinics and you're showing you're showing your filling, etc. It's just really important. We're not trying to be mean, we're just trying to make you guys get the best out of this session. Yeah,
definitely. Yeah, I think you'll get the most out of it and you'll gain the most if you do contribute, so we can help you guys out on your answers.
And yeah, and thank you to the people that have turned their cameras on. Again, we really do hope that you can get involved and enjoy the session today. And yeah, so let's get into it. Let's stop with all this contribution chat. So yeah, so the first thing I thought I'd do is very quickly just go through what the different interview types are, because again, I did go through this last time, but I got a few messages where people wanted some clarity. So the two main interview types are MMIs, which are multiple mini interviews, and panel interviews. With MMIs, these are the weirder interviews in terms of they're not very traditional. So you're normally at you normally get assigned different stations when you go to these interviews, and at each station you get assigned a question. So at one you might be asked an ethical scenario, one you might be asked role play, skills based, knowledge. They're all very different. It's not like a set type of question. It's very different. The next thing to identify with this is that you're assessed independently at each station, so you get a different grade for each one. So let's say you really like struggle with ethical scenarios, you could get a very bad score in that, but you might be amazing at like the NHS Hot Topics, and you can boost yourself up there. So it's a lot more holistic in terms of the assessment style, and a bit more forgiving in terms of, if you mess up, you can improve later on. With panels, these are more traditional, just sit across the table style of interviews, especially because of the whole COVID situation at the moment. Online interviews may be forced to go closer towards a panel style, where it's just a few people across from you, like online. The main things here is that you really need to know that personal statement inside out, because a lot of the time they use that as a basis for the questions, and it can feel more like a conversation comparative to an MMI. And here's a few more like comments I just thought I'd put in terms of like the interview types. I said LMIs are a bit more common when it comes to dentistry, so you have a lot more universities that do this. However, don't underestimate the importance of panels, because based on where you've applied, these may be the styles that you have to do, and because of COVID, we might actually see a greater shift towards panel interviews. So just a very important thing to know. Cool. So going into our first topic for today, that is COVID-19. So obviously it's a massive thing at the moment. It's a massive, problem in society is COVID-19, and this is going to be reflected in your interviews. This would definitely be questioned depending on where you've applied. Maybe not every single area, but you'll definitely be asked about this in your interviews. So you really need to make sure that you're well versed on this. Myself, Muskaan, and Zahra, we've kind of compiled like the key info, like the key bits that we think you guys should go over. And these are PPE, which is personal protective equipment. This includes stuff like masks, gloves, gowns, aprons, visors, goggles. Like there's a few things that fall under this sphere. And the reason why I say PPE is very important, and I put it as the first thing, is because you need to remember that as much as we're trying to treat the patient, and as much as we're trying to provide the best care possible, you also need to protect yourself when you're doing these procedures, or else we're not going to have any dentists left to do anything. So that's very important to remember. Next thing is more related to like the scientific side of things. So this is to do with the transmission of the virus. It's a droplet infection. You should really have like a basic grasp of how it's transmitted, in order to have just so you can talk about it in your interview, because they may ask you the scientific side of things. Next thing is just knowing it's a respiratory disease, and potentially identifying the link between it and pneumonia. That could be something you could do in your spare time. Symptoms and implications, very important. You really should know like the actual symptoms. Don't just go on things based on what the media has said. Really research, do your research, and understand what the symptoms actually are. And relationships to dentistry. So a quick question for you guys. Do you know what an AGP is? Does anyone here know? Like, if you know it, just unmute, just shout it out. I don't mind.
Aerosol generating procedures.
Yes, correct. That is correct. Oh, someone actually got it. Nice. So yeah, so when it comes to dentistry at the moment, there's these things called aerosol generating procedures, and because of the nature of the procedures, they've been cut down quite significantly with regards to COVID. We're not going to go into this now, but maybe that's something you could potentially use as a research topic in your spare time. So we're just giving you guys some ideas like to brainstorm off of. Next thing is an FFP3 mask. So these are special types of fit tested masks that are used by dentists and are very important in the field, to ensure like reduction of transmission. The big difference between these and FFP2 masks is that FFP3 have like, I think it's 99% like efficiency comparative to the FFP2, which are 95%. Might not seem like much, but when you're working with patients all day, it is massive. The next 2 points are relate personal experiences. This is a very good time for you to show empathy and have a research paper ready. So take everything we've said here with a pinch of salt, because you may not be asked everything here. However, it's important to note that you should have like a basic understanding of all these concepts that we've mentioned. Don't stress too much about it, really don't, but just ensure that you have that at the back of your mind, because they will potentially ask you about COVID. And the last thing is, don't introduce any of your political or polarizing views you have on COVID. I don't know if you have any anti-maskers here, but at the end of the day, the universities aren't looking for that. They're just looking to find like a well-rounded individual that has like a neutral view. Okay, remember we're scientific professionals. That's kind of like the premise when it comes to dentistry. So we've got our first question here. Now, I would give a run through about how I want the questions to be answered during this session. The first thing I want to say is, before we do any question, we're going to have you guys just brainstorm together first. So how we'll do this is, we just want you to type in the chat, like put an emoji or put something like that, so that Muskaan or Zahra can pick you out, and then we'll just ask you to, tell us what you were thinking, tell us what you think relates to the question. After this, we'll then pick two people at random to actually answer the question. We'll do it in two parts, like one part, first part and second part. Again, we'll either randomly pick people or two people can volunteer. Again, just write in the chat, please, I want to answer, or just say I volunteer or something like that, so that Zahra and Muskaan can pick you out. And after all that, we're going to give you guys some feedback. So don't that's why I think this is so important. If you volunteer, I know it's worrying, but you're getting feedback from 3 current successful dental students. Like we went through all these interviews, we've got a lot of knowledge to give, and we really do want to help as much as possible. So, you know, it's a really good opportunity for you guys to do so. Anyway, now that I've gone through all that, let's get into the actual question. So the question is, how has COVID-19 impacted your life? So the first part, again, if you guys want to give us some ideas, just like at the moment, just put like an emoji in the chat and then we'll pick you out just so you can give us what you're thinking. Again, Zahra and Muskaan, this is up to you guys to find the people.
I think as well, guys, it's just important to note, try to avoid calling it coronavirus. Try and call it like COVID-19,
Yes.
because obviously coronavirus is like a group of different diseases and stuff. So, and if you know the full name as well, so SARS-CoV-2, like that might as well sort of impress your interviewer as well.
Yeah, just have a basic awareness, like, you know, it was in December 2019, where it was the scientific name. I think that would really help.
Has anyone put anything in the chat so far?
Yeah, so Raheem.
Go ahead, Raheem.
And Khadija.
Let's go Raheem first.
Yeah. Just brainstorming some ideas. I'd say you probably talk about like, what you did in your spare time, because if you're in COVID-19, you're not going to school as much. You just have so much more time to do stuff with your day, basically. So you can easily, if you actually did something efficient with your time, you could speak about that potentially.
Yep, that's good. So talking about like your personal experiences, things that you've like your actual the social side of things potentially. Good. Thank you, Raheem. And then did you say Khadija? Can you go next, please?
That was for the if I could hear you. I'm not really sure about the answer to the question.
Just give us like a little thought. What do you think is, you know, something related to COVID that you could talk about in the question? I don't want you just to answer it. Just give us like a basic, just an idea. Nothing's wrong.
For example, dentally anxious patients who are already scared of the dentist, they might be even more afraid because of the whole COVID situation and the proximity on which dentists have to act.
Brilliant. Yeah, that's very good. And again, there's something that is very important to do is understanding that relationship between like COVID-19. Yeah, it's this virus and it's very worrying, but we also need to look at the mental side of things. So as you said, like dental anxiety is a massive like topic that you really need to be well versed on when it comes to like the relationships between things, like between COVID and dentistry. So very well said there. Let's get one last person to contribute and then we'll get into actually answering the question.
Let's go for Hafsa, I think.
Go ahead, Hafsa.
I think when talking about COVID-19, you would have to mention the impact it's had on the NHS and how it's like, and how the NHS has had to adapt, and specifically the dental field. So that's where you can mention like the PPE and all the health and safety procedures that they've taken. But to make sure that it doesn't sound like all negative, I suppose you could counteract with some advantages. So like this, and the lockdown has made people more appreciative of their family, whilst majority, like nationwide, mental health has sort of plummeted. People have been adopting healthier lifestyle. They've been eating healthier. They've been exercising. They've been looking after their oral health. So yeah.
Yeah, that's fantastic. Absolutely correct. So this adaptation of dentistry, again, is a very important topic, like understanding how it's an ever-evolving field. I'm sure like all of you, or one of you is definitely put in their personal statement something like, oh, I know there's like scientific discovery throughout the career of dentistry. But the reason why, you know, people say that all the time is because it's true. Like you really do need to be on top of things at all time. And not only do we need to adapt scientifically, we need to adapt clinically, we need to adapt socially. Like there's a lot of things in dentistry that make it a very unique career. So yeah, so now we just want 2 people to volunteer. I know it's asking a lot to answer this question. Again, as I said, we're going to be giving feedback. We're going to really be treating this like as if it's a proper interview question. So don't be too stressed out, but understand that we just want to give you as much help as possible. I'm going to check the chat on here actually.
I can go if no one else is going.
Who's Raheem, and who was the person that just said that now?
I'm Matsiana.
Okay, cool. Okay, fantastic. So Matsiana, can you go first? So how would you answer this? How has COVID-19 impacted your life?
So at the start, when it was all sort of going around and everyone was hearing this one word, COVID-19 all the time, it was actually quite scary for me. Mainly because of the uncertainty that I felt. No one really knew what was going on, and it felt a bit weird. It was this massive change. And then once lockdown happened, it all felt very weird, but it's impacted me in both positive and negative ways. There were quite a few things that I actually loved about lockdown. It actually meant I could connect with my family more. My brother, who's at university now, he came back for a few months, which was nice. I could finally be with him more and spend time with him. We studied together as well. He helped me with maths. I made sure that he didn't stress out too much and got enough breaks. And I also loved the fact that I had a lot more time. I do 4 subjects at college, so I'm very limited. I don't have a lot of time to do my hobbies. But during lockdown, I had a lot more time to play my piano, to play my violin, and it was so comforting almost to have that. However, the sort of negative impacts that it's had on me is that I felt quite lonely at times, obviously not being able to see my friends that often, but I was really happy with whenever we had like lessons. It made me appreciate them so much more and the effort that teachers put in for us. So it made me realise that a lot more. But another negative impact that it had was that my mental health was generally fine, but it just made me more aware of it. I could, if I got stressed out over something, I'd get stressed out more because, I wouldn't be able to, for example, go out and spend time with my friends as such. So that was a sort of negative impact of it. But overall, I actually think it's impacted my life more positively because I've managed to have so much time to really focus on myself and grow as a person. So I'm very grateful for that.
Thank you very much. That's fantastic. Cool. So first thing I want to do, just before I get Raheem to answer here, just want to give a little bit of feedback. So I'm going to start with Zahra. Zahra, what do you think of the answer?
I think it was really good how we could understand that you showed, I think, a lot of empathy through that. And I think obviously that is a really important thing when you're coming into this degree. And it was nice to hear a little bit about your personal experiences. And I liked how you did drop in your hobbies and stuff, because that is important. Like literally every dental student I know has something that they do outside of dentistry. And as well, especially like speaking as a King's student, King's interviewers are really sort of into your personality and stuff like that. So it was good. You showed a lot of emotions, like using the hand gestures were appropriate. The only thing that I would say is this question is quite funny because some people might sort of take like a really personal approach. Others might talk a little bit about dentistry, but I think it's good to have a balance. So maybe like a couple more points about dentistry, but we can go through that at the end after we hear what Raheem has to say.
Yep.
Muskaan, do you want to go next?
Yeah, so it was really good how you mentioned like your own personal experiences, really realistic about the situation. So you highlighted positives, but you also said, a negative about your mental health, but then you ended it on a positive note. So I think overall that was a really good answer. And as Zahra said, you could bring in dentistry because this is an open-ended question, but we'll go through that now.
Fantastic. Cool. As I said, I think there's not really much more I want to add, as I agree with both Zahra and Muskaan. The biggest thing I would have said was I'm going to be a bit more like direct with it. I would have 100% said you should have made more links to dentistry. Like, I know that it's a bit of a grey area, but whenever you're trying to answer one of these questions, remember you're applying for dentistry. So every time they ask you this, you have to be thinking at the back of your head, how can I make a relationship? I've written down a couple of things, but I said we'll let Raheem go first and we'll go back to you. So yeah, go ahead, Raheem, please.
I would say that COVID-19 has definitely impacted my life, as just before we went into lockdown, I was fortunate enough to actually receive spinal surgery. However, due to going into lockdown, I was unable to actually get physiotherapy and go through the proper post-surgery treatment. So during lockdown, I had to take my own initiative to like actually put measures in place so I could regain my fitness post-surgery. So obviously, because COVID-19, I couldn't I was restricted quite a bit with what I could do. But the key for me was getting into a routine where I was doing exercises at a certain time, making sure I was doing my exercise the right time, doing it consistently enough so it could improve my fitness. And obviously, I could do that by during the peak of lockdown. You could go on your jog, walks, wherever your exercises were. However, I'd say how it had negative impacts on my life as well, as I am relatively pretty sociable. So I like going out, I like meeting my friends, playing sports with my friends, which we do on a weekly basis, usually playing football and cricket. So being unable to play my sports as I usually did was pretty hard, and not being able to just meet with my friends. So that was probably another way it impacted my life. But as I said, also during COVID-19, my actual retainers broke in the first couple of weeks, which is a bit unfortunate for myself, because there's the bottom layer, it snapped in half. I remember I rang up my dentist and I was like, can I do anything? But at the time, because it was just going into the lockdown and there was a lot of emphasis on protection in dental clinics at the time. So at the time, unfortunately, I couldn't actually do anything. But it made me realize how careful the dental practice were being. And I appreciated that, because I know as a dental team, you have to put the patient's interest first. And even though for me, it's like, oh, I want to get my retainers fixed, get those measures in place so that I can help my teeth stay straight. Obviously, I have to think about the wider perspective of things. So that also during COVID-19, obviously, I was able to spend a lot more time with my family, which was a nice thing, because obviously, because my dad was no longer having to go to work because of COVID-19, I got to spend some time with my parents, which usually you don't get to spend as much time. And even just spending time with your siblings. Like I said, I was playing sports and stuff, little exercises in my garden. So my siblings were helping me out with my rehabilitation, because obviously doing it at home is not easy, but I had to make use with what I did, because it's not always easy, but I had to try and be resilient in the situation, because it can be hard. But like I said, being in a routine was nice because it allows you to do your stuff efficiently, and having key time management, I felt, was really key during this period.
Fantastic. Thank you very much. Just so you guys know, I can't access the chat too easily. So any messages that you send, they'll be going through Zahra and Muskaan. Whatever they say is what I say. So they're going to be like my spokespersons for the session today. In terms of Raheem, your answer, fantastic. Thought it was really good. I'm going to go first this time. In terms of relating your spinal surgery, talk about having no physio, etc. It was good for you to give a personal example. One thing I would have said was you could have actually done a link from that lack of treatment the fact that you had a lack of treatment, you could relate that to dentistry, but luckily you did that later with your retainer anyway, which is fine. But the reason why I say this is because I feel like a lot of people might feel that, oh wait, but I don't have an example where my retainer broke, or I don't have a dental example. Well, that's not an excuse. There's always ways to make links between different things. Like with Raheem, for example, he could have, if he hadn't mentioned his retainer, he could have mentioned, okay, through my spinal surgery, wasn't able to get physio. It made me realize how difficult it must be for dental patients that want to receive care, the importance of working at home, and triaging with dentists and patients. There's a lot of different things that you can pick out, but you just have to make that link. The interview is not going to make the link for you. It's your job to do so. But yeah, so I think that was well answered in terms of that. Yeah, I'm going to give the rest of that to Zahra and Muskaan. Muskaan, go first. Sure.
Yeah, I'll go first. That was a really well thought out answer, because you mentioned your personal experiences and how you actually tackled that by doing sports and exercise and fitness. So the interviewer gets an idea that you're a well-rounded person as well. And the fact that you mentioned retainers being the retainers they broke, and how you appreciate the dental profession, and how putting your interests first. That was a really good point that you mentioned. So I think you made that link really well.
And finally, Zahra.
I agree with them both. I think you've done really well. And the only thing that I would say is that obviously all of you guys who are applying, you're all prospective dental students, so you sort of understand it more from a dentist perspective. Whereas if you think what you said about not being able to get your treatment, relate that to if you were just a member of the general public, you could say something like, obviously as a dental student, I understand the implications of COVID-19 and not being able to see the dentist, but with a lot of the generic public, you can understand that there would be sort of a lot of frustration and a lot of anger amongst people who are unable to get treatment, like, because the main reason why people come to the dentist is because they're in pain. Do you know what I mean? So a lot of people will be stressed out that they can't come to the dentist. They will be angry, and obviously speaking to a dentist on the phone, they don't see it the same way as seeing them face to face. And another thing that I would include for sort of anyone that you can say, even if you don't have an example, sort of like Raheem, you can say a lot of people have been stressed out about the whole situation, about lockdown. A lot of people have had issues with their like have had mental health problems, etc. And even just being a little bit stressed out, which means that a lot of people are probably not going to prioritize their oral hygiene. They're not going to prioritize toothbrushing. People might not feel, they might be too stressed out and might not want to look after their teeth as much. So you can imagine, as well as like the backlog of all the appointments that we'll have because of lockdown, because dentists weren't able to treat patients, you could imagine that there's probably going to be patients who had problems progress, so like carious lesions. We even have a friend who actually developed caries over lockdown, and it was probably because she was unable to go to the dentist and have it identified early. So now it's quite sort of late. It's later than it would have been if she was able to do that. So that's something as well that you can add into your answer where it's relevant.
Cool. But yeah, that's fantastic. So yeah, so I hope you found that useful, Raheem and Martiana. Back to the first answer, one thing I would have said, so in terms of where I think you could have made a link to dentistry is, you mentioned like things with your mental health and how you thought it had a potential impact because you weren't able to see your friends, etc. You can make a link about that to dentistry. So talking about like dental anxiety, talking about how difficult it must be for patients not being able to see their dentist and get treatment. So that's one link I would have made for the first answer. Just in case you were wondering, like, you know, how can I do it? Because I didn't mention anything dentistry related. So yeah, cool, fantastic. But those first two answers, again, thank you very much, guys. Fantastic answers. Let's go to the next section. So yeah, as I said, I'm going to be sending these slides out, so you guys will be able to look at these extra questions that I've made for like related to COVID-19. Like these are things that I think that interviewers might ask you potentially. Cool. Okay, so now the next part I want to go into is why dentistry. So again, I've gone through this slightly in my last webinar. I'm going to whiz through this very quickly. So with why dentistry, the key point of this is to show your passion. I can't stress this enough. Passion is the most important thing here. But you also need to understand that you have to have the right content within your answer. So ensure that you're weighing up the positives and negatives. Ensure that you're introducing your work experience, volunteering, personal examples is very, very important with the why dentistry questions. And some people may argue or make the point that this question is literally just work experience, because in work experience, that's the one time where you really get to see dentistry face to face, and that's the one time where you really get to see, okay, can I see myself in the dentist position, or is this just some reality that I thought would be amazing but isn't really? So yeah, and the last thing I'd say is make it short and sweet. So really try and be concise. One thing that I say with all interview questions, just because you get given 5 minutes to answer, it does not mean you need to fill those 5 minutes. That is a misconception. That is not true. You need to understand that within that conversation, you need to have enough confidence to stop when you're done, like stop when you know I've said a good answer already, and have the confidence to probe further when you feel like more needs to be said. And at the end of the day, the interviewer will prompt you or probe you if they feel like there's some things you haven't mentioned. So yeah, but you have to have that confidence. Next thing I'd say is the don't, just very quickly. Do not waffle. I'm not going to go into it. Like, just don't waffle. Don't say a load of stuff and think this is going to be fantastic. If I say a lot of stuff, it shows I'm intelligent. Shows the opposite. Being concise is the answer. And don't try and rehearse something or relate it to money, which is some people still do, or relate it to like, oh, my uncle was a dentist, so because of that I saw teeth and teeth made me want to do dentistry. Because it might be your passion, but it's not something unique, and it's not something that the interviewer is really looking for. So yeah, so we're going to go right into a why dentistry question, actually. So again, same thing. We would really appreciate it if I'm just going to get two people to answer straight away off the bat. So yeah, let's just see if you guys can just put your names in. I want to see the chat, actually. Cool. Okay, so I just actually saw I'm just going to very quickly before we get into that. Someone asked Faiza, I think, asked a question. She said, "What if you couldn't get work experience due to COVID? I've done a work experience in hospitals though, and from there decided medicine was not for me. Great question. We were going to cover this later on in the webinar, but I guess we should do it now while people are still, volunteering for the question. The main thing I'd say here is you need to find an alternative. Like, you're quite lucky that you had medical work experience anyway, so you can still use that as a basis for certain things. But with regards to dentistry, I'd say do some research the topics that you find interesting, like even getting in contact with different dentists online. Like, the internet is such a powerful thing, on Instagrams, etc. Getting different content. What else is there? You can do a MOOC, which are these online courses that really teach you quite a lot about dentistry. In general, you just need to find things that show your passion in dentistry. Usually people think that the only way that I can show my work experience, my passion, is through work experience, but there's other means to do so. So as I said, let's just summarize that very quickly. So doing these massive online courses, getting involved on with dentists online, and the last one I'd probably add on to that is potentially like writing something related to dentistry. So even like a short essay or any piece of writing or research that you want to do in your own time that shows like that you've gone out of your way to learn something about dentistry. So yeah, hope that answers your question, Faiza, and that is okay. So yeah, with regards to this question though, so why dentistry? We need 2 people to volunteer, please. That's fine. If your camera doesn't work, that's absolutely fine, Alex. So we've got Alex, and we need 1 more person to volunteer to answer the question. And Amira, fantastic, cool. So I'm going to start off with Alex, please. So Alex, I'm going to ask you, why dentistry? I'm going to give you about 3 minutes to answer because we need to just keep on track with time, but I will tell you when you're approaching that 3 minutes. So go ahead.
Okay, that's fine. Great, thank you. So I'm not someone who's always had the dentistry. I want to do dentistry forever since I was young. That was nothing that ever really came into my mind until 6th form. So when I was younger, I was always really creative, and I always knew that going through school, I always loved biology and like my chemistry, and I was like just fascinated by how the body worked and how things came together. It was a bit like, ooh, and then I was just like so captivated by it. And then when I was going through 6th form, it was like careers being thrown at you everywhere, and I was just like not ready to decide. So I decided to take a gap year, and I've just been doing lots of research, and I'm just like fascinated by the diversity of dentistry and like how many specialities there are. Like I really like the cell biology and like oral pathology, but I also like maxillofacial surgery, like the really hands-on aspect of dentistry. And that was something that I connected to with when I was younger, and I was always doing my like creative arts and things like that. And then as I've got older through my gap year, I work in a restaurant. So I am very used to a high pressured environment. And I know that dentistry is very time pressured, and there's always like tons of stresses going on all around you. And just working in that atmosphere with lots of people in a very big team, it's just like, I don't know, I just like feel at place in working with lots of different people and meeting new people. So yeah, that's why dentistry.
Okay, thank you very much. Cool. I'll tell you in total, what's it called? Yeah, so that was about a 2-minute answer. Absolutely fine. What I would probably do in a real interview is maybe probably a bit more about some things. I'll go into a bit more detail with that now, but first let's hear what Zahra has to say in terms of her feedback for this question.
So I think you've done really well. Thank you for volunteering. The only thing that I would say is that just make yourself relate it a little bit more to why, as well as they're asking you why dentistry, this is your opportunity for you to show why they should pick you as a student. So for everything that you talk about, a lot of people, you have to understand, like, even though this might apply to loads of people who are really genuinely interested in dentistry because of like as a child, etc., but it's just important to understand that that is a little bit of a cliche, and interviewers have probably heard it like a lot of times. So just find something that makes you unique, and as well as why interests you, why they should pick you as well. So it's like a two-way thing, kind of.
Yeah, and Muskaan?
Yeah, I agree with Zahra. That was a really good answer. Again, I would just put a little bit more emphasis on dentistry and the fact that you build patient relationships and that rapport. So that's the main, aspect of dentistry, along with the clinical side and the intense knowledge that you have to have. The whole ongoing patient relationship is really, really important.
Yeah, that's true. And just a few things I would say, like specific to the question. You mentioned that you really find hands-on dentistry very interesting. So one good thing you could have done there is then told us how you might have developed those skills. Tell me what you said that when you were younger, you were quite creative. That's fantastic. But what are you doing now that, brings that link between you and dentistry? Because as Zara was saying, you're kind of like telling them what's interesting about you as well, like not just why you want to do dentistry, but why they should pick you. So if you told them something like, oh, I've improved my manual dexterity skills, but I don't know, like sewing or art, etc., and I really think this is important in dentistry because I want to go down a career related to like max fax or like hands-on dentistry, that would have been fantastic. So yeah, so the reason why I say this is because a lot of people unfortunately fall into this trap of like giving very very generic answers in terms of like the key points they want to make, and the way that you can make yourself more unique is giving that personal touch, and that's the one thing I feel like you should have just done a little bit more here. But it wasn't a bad answer at all, but as I said, you just need to make more links to dentistry and more links to yourself. So yeah, cool. And now let's go into Amira, please. That'll be fantastic.
Hi, okay. So one of the main reasons why I want to go into dentistry is because whilst I was fortunate enough to conduct some work experience, I was able to shadow a couple dentists for 3 weeks, and I saw how the profession really nicely incorporated all the different things that I really truly aspire for in a career. So firstly, I was able to see how the dentist did really difficult and complicated procedures such as root canals, and it highlighted to me how dentistry nicely incorporates my love for science, but also that desire to do operative work from early stages in my career. Secondly, I think that dentistry is another really great profession to go into because it's constantly evolving, which means that will most definitely ensure a lifelong learning opportunity, and also that opportunity for continued professional development. So whether that might be me specializing, I've always wanted to go into orthodontics, or carrying out some sort of research, or going into academia and perhaps teaching some dental students when I'm older, that gives me that really nice choice to do so, and there are different career paths available for me. And then finally, I think another really important thing is the fact that I'll be able to interact with different people, whether they're young or old, daily, and make a difference in their lives. I remember when I had my dental treatment, it was really nice seeing how the dentist was able to establish rapport with me and see my dental journey through from start to finish. And it was really nice having that same person in which I could instill trust in, and I would really love to be able to do that for someone else. So those are the 3 main reasons why I would really like to study dentistry.
Okay, brilliant. Thank you, Amira. Yep, so that was about 2 minutes as well. Fantastic. I'm going to start off by, saying, number one, I can tell you've really read up on this. You really have quite a lot of knowledge when it comes to this question. However, I think you might have fallen into the trap of sounding a little bit too structured. I felt at the start, it felt like a tiny bit like list-like. You talk about like I want to be a lifelong learner, difficult, complicated procedures. I felt, again, it felt less personal, even though I could tell that you were really, really well versed and you really did know what you're talking about. Like, I can't fault you there, but if I had to really critique, I'd say try and introduce more personal experiences with that. You did so at the end though, when you mentioned like your rapport building, which was great. But yeah, that's the one thing I would have said, is potentially like have it a bit more free flowing, less structured, because as I said, I can tell you really have read up, and I can tell you, like, you've mentioned some very good points like CPD, which even I didn't know what it was when I was applying to dentistry. But again, you might fall into that trap of sounding too structured in an answer, which is what they don't want to hear. But as I said, not bad. I'll then move that on to Zahra.
I think in terms of what you said, it was really good as well. I'd agree with Faris. So even if you have like got a structure to your answer, just rehearse it at home by yourself, trying to make it sound less structured and more sort of free flowing. And the only thing I would say to answer, to also add in, is when you said about seeing the same patient again and again, that is your chance, because I know we're only giving you 2 minutes. In the real thing, you'll have about 5, depending on where you are. Just important to say that you do build a rapport with the patient, which is like a word that they really like to use. So that's RAPPORT for anyone making notes.
Yep. Just really quickly, sorry, going to interject. I've just seen Alina on the chat. I can't type on the chat, but I can reply like via messages here. You said if you want to answer the why dentistry question. If anyone wants to answer questions, again, make sure you volunteer first because it's first come, first serve. But we will be doing I will be going through some questions at the end. Don't worry, I'll let you answer questions if you still feel like it, time permitting. So don't worry about that. And someone also asked, can we access the other webinar? Yes, you can. It's on my YouTube channel. Literally just search for interview webinar. You'll find it there. It's 1 hour long. You can watch it ×2 speed and get all the information you need. It has a lot of the basics when it comes to the different styles of question and how to answer them. This session is more related to going through questions and you watching how other people applying to dentistry would answer these questions. Because at the end of the day, you need to learn from each other, but you are also competing against each other, which is, an important thing to remember. But yeah, really make sure that you take this constructive criticism and learn from it. Sorry, go on, Muskaan.
Yeah, so Amira, that was a good answer overall. The only thing I would say is that you mentioned, appreciation of the different specialities of dentistry, which is good. But I think you said that you've always wanted to go into orthodontics. Now, personally, I wouldn't mention a speciality in your interview just because you might fall into the trap of the interviewer asking, how comes you came to that decision so early on, before even starting dental school. So personally, I would just have appreciation of the different specialities, but I wouldn't go into specifics because even as a third year dental student, I still don't know what I want to specialize in. So yeah.
Yeah, I actually was meant to say that. I had that written down in my notes, but yeah, it's just there's this trap where anything that you say becomes an avenue for an interviewer to ask questions. So don't ever mention anything you don't want the interviewer to talk about. And also the word always is a very extreme word. Don't say always because then they'll be so as Muskaan said, how did you come to that conclusion? What do you mean always? This is when you are straight out of the womb you decide you want to do ortho. So it's some interviewers can be really mean. Trust me, I've dealt with them. So don't try not to fall into that trap. But yeah, as I said, overall, very good answer from both of you. But I feel both of them, the only thing I felt we needed to hit home a bit more was the personal qualities, really introduce that personality a bit more. It can be quite hard because you're trying to say so many things to show the interviewer that you're interested in dentistry. But as I just said, both of you, you answered in about 2 minutes and the answers were brilliant and you would have had so much more time in a real interview to add on these extra things with personality and stuff. Before we move on, just to Alex and Amira, are there any things you guys want to ask us very quickly with regards to this or anything you want to comment on?
I mentioned in the chat, I don't know if you've seen it yet, but I said that I wanted to at the beginning perhaps discuss what sparked my interest in dentistry, but then I just mentioned here that I'd have so much more time. So yeah, I completely agree with all the feedback that you guys are able to give, and I thank you for that.
No worries. As I said, this is more of a simulation. I don't mind to be honest, I don't mind you guys going over a bit in terms of the timing. As I said, I'll tell you if you get close to the time. So really, just use the time as much as you feel is necessary. So don't worry too much. But yeah, cool. So let's go. And sorry, Alex, did you have anything you wanted to ask or say before we move on?
Yeah, it's just a bit more general though. When you get given a question, you can pause and think. Yes. But is it all right to note something down? Do you get what I mean? Because I know it's online this year, so you kind of want to be looking into the camera.
Yep, you do.
But sometimes when you're asked a question, your head just goes all over the place. So I'm wondering, would that be something that we could do, or would you recommend not to?
I would. I'll see if Zahra and Muskaan disagree. I'd definitely say no, because you might have a piece of paper down in front of you that has answers on it or like a cheat sheet, and the interviewers don't know this. Again, I'm not going to give any official advice. You have to get this checked with all the universities you're applying to. They may, they may allow you to have one piece of paper if you show it to the camera or something. But I'd personally say, even in my interviews, I didn't know anything down. I'd just take 10 seconds at the start. I'd be like, thank you very much. I'm just going to take a couple of seconds to think if you don't mind. And I'd start my answer. When I felt like it. Again, I'm pretty sure Zahra and Muskaan had different approaches, but we'll be going into that in a bit more detail later in the webinar. So don't worry about that. We will be going through how we kind of answer the questions in our top tips. And again, just reading the chat. Yeah, I am doing a series of webinars, so just make sure you stay tuned with my socials, and I will be doing more of these. Don't worry. Cool. Okay, so the next one. This is the big one. Ethical scenarios. So these are. I feel like a lot of people are really stressed out about ethical scenarios. They get really worried and worked up, how am I going to answer this properly in the time that I'm given? And the way what I'd say to this is, these questions are only hard because people don't know what the interviewer is looking for. A lot of the time people fall into the trap of shoehorning in the 4 ethical principles. They think, oh, I need to mention autonomy, I need to mention justice, I need to mention beneficence, non-maleficence. Like, you don't. The whole point of it is to have a good flow to an answer, and this holds true for all types of interview questions, by the way. It's to make sure you have a good flow of an answer but still cover the content that the interviewers are looking for. So the main things I would say are is that you should consider both sides of the argument. So a lot of the time in an ethical scenario, you're given something where you have to evaluate, and evaluation is very different than description, because you have to really take into account the different factors and like weigh up, why I think this option is good, why I think it's bad, or why I think this treatment is good, why I think it's bad. There's a lot of different ways to evaluate as well. We'll be going into that a bit more later. Next thing is to make sure that you really listen and understand the scenario correctly. A lot of people fall into this trap of skimming through the scenario and being like, yep, I kind of get it, and then they don't really understand the scenario. They miss something at the very end that changes the entire way you answer the question. So it's very important for you to read the questions thoroughly and really understand what it's trying to ask you. And the last 2 things I want to mention are, make sure you read over your GDC principles. Muskaan is a bit more knowledgeable on these than I am, but she would say, like, make sure you learn all 9. I'd say don't worry too much, like have a brief understanding of them. But again, that shows you how like everyone has a different approach when it comes to these interviews. Even though we both got into King's, we both had very, very different approaches to the way that we approached our interviews. So another thing, like, disclaimer, don't take everything with a pinch of salt, and understand that there's different approaches for every type of question. And the last thing is just make sure you come up with a fair and balanced conclusion if you can, or if you have time. Again, don't feel forced to do this. Cool. And that's that. Brilliant. So here is the ethical scenario. I'm going to ask you guys in the chat. So we're going to do some brainstorming first. So I'm just going to get a few people, just put an emoji in the chat. I'm going to read the scenario now if you want to like brainstorm, give a few ideas. So question is, a 25-year-old woman comes to your dental practice because she is unhappy with the appearance of her teeth, as she feels they look crooked. On examination, there is no clinical indication that she needs braces, so she does not fit the criteria for braces on the NHS. The woman explains to you that her teeth make her very self-conscious and is causing her to feel depressed. What do you do in this situation? I just want to give credit to the Medic portal because I kind of, nicked it from there. But there's a lot of these amazing questions that you can find online, and I've got a couple that I've made up as well later on here. When researching a question. Yeah, as I said, to anyone that's asking questions about interviews right now, we will not be answering them. We have a Q&A section at the very end, so we'll be going through all the questions you guys want to do, or like any like hard things that you've encountered online. Like, don't worry about that. We've got that scheduled in at the end. But yeah, just now all I want is some people just to like put something in the chat. Like, we just want some brainstorming. Like, what things do you think you need to mention when it comes to this scenario? Anyone?
Hi. So you can be like, you understand that they want dental care, but maybe you could suggest private care if they want to go for that. Or you could say that we can't provide the clinical care for you because it's not essential, but still be understandable of their opinions.
Okay, cool. So you're saying potentially refer to private care as an option. Cool. One thing I'd just say is just be careful with saying it's non-essential. That's not up to you to decide what's essential or not. It may not have like meet the criteria of the NHS, but it doesn't mean that that patient doesn't consider it essential. At the end of the day, it's the patient's decision. This falls under this whole category of autonomy, where they decide if they really need that patient treatment or not. And using language like, "Oh, this is non-essential," may potentially like worsen them. And we can already tell that this is someone that might be a bit more sensitive. So we wouldn't really want to go down that avenue because, as dentists, we have to take into account obviously their physical health, but also their mental health. So just bear that in mind. I'm looking through some of the messages in the chat of you guys saying. So someone said to empathize with the patient's feelings. Yep, that's correct. We need to empathize. A quick question: what is empathy? What's the difference between empathy and sympathy? Let's get someone, like anyone, just unmute your thing and give me an answer to that. Validate the concerns. Oh, I think someone has unmuted on the thing is very loud. Okay, that's fine. Whatever. Cool, I'm going to come back to that. Again, yep, so maybe consider beneficence because you want to do what is in the patient's best interest, as they don't need it. You would explain that you can't provide it, okay? Validate their concerns, it's a sensitive situation, correct. May cause potential future mental health issues, affect affect use of NHS budget? Okay, and that's an interesting one. How the lady can invest in cosmetic Invisalign that is not provided on the NHS. Alternatively, if she cannot afford the private dental care, also address her concerns about her teeth and how why it affects her. Boost her confidence with some comforting words. Cool. Explain the situation and highlight the cosmetic care is available. Autonomy, respect their desires. Cool. All of these are good points to raise. I think. Oh, we've got one big one here. I'm going to read. This is the last one I'm going to read, and then we're going to get into answering the question, guys. So here it says, this patient is already going through, this is Mark Jana, I think it is. Sorry if I mispronounced that. This patient is going through a hard time, so make sure you understand her and be human with her. They are your priority, so make sure you're polite and gently check if there are other factors that are making her feel self-conscious about her teeth. Good. Then see what can be done. Talk to her and listen while also politely explaining what you can and can't do. Brilliant. One thing I want to mention there is mentioning what you can and can't do. That's really important because a lot of people right now have said, refer to private, refer to private, refer to private. Well, you may not be able to provide her with braces, but you might be able to provide an alternative treatment. I don't think anyone else has like really picked up on this. You don't just like, this is like sort of like a tunnel vision thing that some of you have done, which you're thinking, no, I can't do anything. No, it's not an essential treatment, so I can't do anything. I just need to give it to private. Well, there's other things that we can do to work around this. Like dentistry is a very malleable career. There's a lot of different treatments that we can provide. So that's something that you could potentially do. And the last thing I'm going to read here is by Faiza. I think she said, is it appropriate to refer to private clinics if you're under the NHS? Could it be a liability on your half? No. So yeah, cool. So we just want 2 people to answer this question, please. That would be absolutely fantastic. Just get that in the chat. Okay, we've got Toya. And Amira, I will get back to your question, by the way. I'll just do that at the end if that's not a problem for you. So we've got Toya. I mean, one more person just for this ethical scenario.
Parthivi said as well that they don't mind.
Parthivi, okay, cool. Cool, okay, let's get Toya. I want you to answer this first. So your camera doesn't work. That's absolutely fine. Let's just get, we just want to see how you can answer this question. So go ahead.
So according to the NHS, as a dentist, you can only administer treatment that is like clinically necessary. So in this situation, you shouldn't actually give her braces, even though you would understand that she's feeling self-conscious and quite like lacking confidence about the way that her teeth looks. But I think in the situation, it's really important to explain to her why you can't administer the treatment due to the NHS, the different treatment plans that are available on the NHS. And I think it's important to do this through empathy and being really understanding of the way that she's feeling. So I think that you should ensure that she is feeling quite, she understands why that you can't administer the treatment, and you're listening to her concerns as well, so that by the end of the appointment, she's not feeling worse about her condition. I also think that you shouldn't guarantee her any treatment. So you shouldn't say, in the future, we can definitely give you braces, because as a dentist, you don't know if her condition will deteriorate or whether it will improve.
Good.
So you shouldn't guarantee her any treatment, but alternatively, you could possibly refer her to a private practice and maybe give her Invisalign, because this is an alternative that is offered in private practices.
Sorry, I'm going to cut you off very quickly. Sorry, because might as well do this. So what is Invisalign?
From my understanding, I know it's a clear brace, which helps. It's mainly for the aesthetics of the teeth. I don't really know much about it, but I think
that's fine.
I don't really know much about it.
That's fine. That's fine. Okay. Sorry. Yep. Go on.
So yeah, I think the main thing to take away from this is you have to really show empathy towards the situation and ensure that because she's feeling depressed and self-conscious, you want to ensure that you're understanding what she's feeling like, and that she doesn't become her mental health doesn't deteriorate after the appointment.
Fantastic. Okay, thank you very much for that answer, Toya. So I'm going to give this to Muskaan first. Muskaan, what do you think of this answer? What was your opinion on it?
I think it was, a pretty well thought out answer when you said that you have to explain to the patient, but take in, concerns and show empathy, which is good. Yeah, I think when you mentioned Invisalign, you didn't really, when Faris asked you, which is fine not to know everything about it, but I think it's just, you know, jumping in there, and then the interviewer could question you, so you have to be prepared. Just so you guys know, Invisalign is basically a clear aligner, and it helps with crowding of teeth or like, you know, correcting your bite. So yeah, that's just what Invisalign is.
Yeah, I just wanted to say one more thing. Yeah, I wasn't being mean there. I was just trying to emulate for you what can happen if you do mention like a key term, and why it's important not to just throw things in there, because a lot of people think, okay, if I mention Invisalign, oh, it shows, you know, I've read up, I've done the X reading, and I'm sure you have. But well, at the end of the day, I didn't even have to say anything, and it got to a point where you said, oh, I don't really know much. So that can actually negatively impact the answer rather than help you. So it's just something very clear to mention. Another thing to say is, a good thing is, I did this in my interviews, just like a little tactic I did, was I'd name drop certain things that would sort of like be things that I've actually done a lot of research on. So I'd want the interviewer to pick up on them. So I'd mention things like I didn't really research Invisalign, but for example, I'd mention things like Invisalign or like braces, etc., etc. And I'd wait for them to prompt me and, you know, try and catch me out. And instead, I'd actually have like a very good answer for it. So that's one thing I'd say you can do if you want to. It's a bit risky. It's something I did. It worked for me. But yeah, just really make sure if you mention anything, especially if you name drop like a brand or something, definitely know what it is, definitely know everything about it, and not everything, sorry, but like definitely have like some clear info about it before you think of suggesting it. And yep, just Zahra, do you have anything to add on to that?
I think you guys covered most of it. I would just say that it was good that you spoke about actually communicating towards the patient, because I think that's really important, especially as a dentist, you're going to be with people from like a diverse range of backgrounds, and it's important to make them understand as well. And I'm not sure about Muskaan and Faris if they'd agree, but me personally, when I did my work experience, one of the dentists told me that if a patient is not, even after you've tried your hardest to make them understand, if they're still not taking your advice, sometimes it's helpful to get like your colleague in to see, like, for them, the patient is like to get a second opinion. And then, okay, now it's two dental professionals are telling me I don't need this. Do I really need it, kind of thing? So sometimes it just sort of they just sort of back up what you're saying, but in a way that sort of makes the patient feel like reassured as well.
Yeah, absolutely fantastic. Exactly. So getting a second opinion is always something that can be considered in dentistry, and it's like a really easy thing that you can mention in an interview as well, because if you know that it's a common practice, you can mention it in like more difficult scenarios like this one, for example. Thank you very much, Toya. I think the other person that suggested they wanted to answer was Parvati, if I'm not mistaken.
Yeah, hi.
Go ahead.
So in this situation, I would first of all make sure that this patient isn't disheartened or upset by you telling them that they can't really have braces on the NHS. I think I would look into obviously other options, such as referring to private care. I think you can also fix slightly crooked teeth with maybe composite material as well. So that's something that I could suggest to her. Maybe see if she's okay, maybe not suggest to her, but see if that's an option for her. I would also look into the fact that it causes her to feel depressed. That's something of concern, and I would maybe ask her more about it.
Yep.
Yeah.
Cool. Is there anything else you'd want to say for this answer, or are you satisfied with what you said so far?
So some possibilities for alternative treatment would be Invisalign or Damon braces as well that I've looked into. Yeah, other than that, that's all I have to say.
Okay, thank you very much. Brilliant. Cool. As I said, I was literally just going to do the same thing and like delve into like Invisalign and what you know about retainers, but you've kind of understood the importance of that now. Yeah, so what do you got? I'm going to go to Zahra here. What do you think, Zahra? What's your view of this answer?
I would just first say that just in how you speak, I could tell you're a little bit nervous, which is absolutely fine because I know this is like a environment, but just maybe practice a little bit more, just so you feel a little bit more confident in your answer as well. I think Faris was trying to throw you off, which some interviewers might do, like they might ask you, are you finished? It's okay to say that you're finished. And as well, just it was related as well to what Toya said, and when she mentioned Invisalign as well, if you're going to mention something, have the knowledge as well to back it up at the end. When Faris asked you if you have anything else to add, just make sure you have, if you're going to mention a specific type of treatment, be prepared to be questioned on it, I would say. Yeah.
Yep, exactly. That's fantastic. Muskaan, do you have anything you want to add on, or?
No, I'm good. I think I agree with you, Zahra.
Yeah. One thing I'd say is, again, might be because of the situation, but I felt like the answer I said was a tiny bit on the nervous side, which again is fine. We understand the situation, and a little bit on the short side. I feel like something could have been fleshed out a bit more, but I feel in an interviewer might have like pressed up on some of the points that you made to get you to talk a bit more. One thing I was going to say is, yeah, your mention of composite is correct. That's one thing I was going to mention. Sorry, that's the timer for the question. That's one thing I would have mentioned later as a way like you can kind of fix a crooked smile. You can use composite to fill gaps in certain situations, especially with the two upper central incisors. There's a lot of very interesting procedures out there. So that's kind of an answer to you, Amira, earlier, because you were like, how can you fix someone's crooked teeth without braces? That's one way that it can be done. It's a massive world out there in dentistry, and there's a lot of different things that you can do. Is composite provided by the NHS though? That's something you can have a little look into. As I said, there's different treatments that you can consider, and I'm not saying that every single one you should suggest to the patient, but these are things you can suggest for them to get referred to at a private clinic, or something that you could say you potentially could have like in a future session. You could have a little check again on their teeth, just to show that you really do care about their concern, even though you may not be able to provide braces. A lot of the time it's about building up that rapport with the patient, and even though you may not be able to provide like absolute clinical treatment, sometimes just being there and giving them an understanding that you do understand their concerns can really help with the treatment plan. So yeah.
Hiya, I just have a question.
Yep.
I was just wondering, how the patient says that they're depressed, would it be the role of the dentist to like give mental health advice maybe, or should we just believe in that?
With regards to this, it's a bit of a sensitive topic. You definitely would assess like the patient, see how they are, like have a discussion, building up rapport. But in terms of like more serious care, you would refer them to like some mental health services that would probably be initiated at your practice. It's not like your absolute role to be giving all the mental health advice, because we're not fully qualified to do so. If Zahra or Muskaan want to add on to that, they might be a bit more knowledgeable than I am with regards to this.
Thank you for asking that, because even like Farah said, even though we're not qualified to give the advice, I agree, like we shouldn't give the advice because we don't have the knowledge, but it's important to flag that up, especially if the patient has told you now you put that in your notes. If something does happen in the future, something does happen to the patient, their mental health does deteriorate, and that could be an example of dental negligence, because as well as dentists, we need to be looking after patients holistically as well. So identifying other things, that is really important to flag that up and refer them, and sort of try and speak to them more about it, ask them if they would like to be referred, etc., and just do your part as well, like a professional.
Yeah, so I hope that answers your question. Yeah, we will get into the next question that we have here. Again, these are some more ethical scenarios you can do at home in your own time. Cool. So we're going to take a tiny little break from just answering questions, because I feel we've peppered you guys with a lot of information. So now I'm going to hand over to Zahra and like some of her top tips when it comes to like online interview etiquette and the do's and don'ts when it comes to doing these new style of interviews online.
So I think we already covered this. So look at the camera, not at your screen, because if you guys look at me now, I'm looking at the screen now. The interviewer on the other side, they can't tell whether or not you're cheating, whether or not you have like notes up. Now, if you're looking at the camera, I'm looking at the camera now, you can all see that I'm looking at you. There's no way I could possibly be cheating. Dress as you would for an in-person interview, and I mean your shirt, your trousers, skirt, whatever. As well, I think it's important for like sort of below what's seen on the camera. It's important as well just to get yourself in that interview mindset, and also just avoiding like an awkward situation in which for a role play you might be asked to get up. I'm not sure how they're doing this, so it's just important to be prepared for any situation, and it would be kind of embarrassing if you weren't prepared. Focus on your posture, don't lean into the screen. I know even myself, I've been doing it a lot through hair. It's important to sit up straight. Sit where you have good lighting. Most of your interviews will most likely be in the day, so face a window, don't face away from it. Ensure you have like a clean background, nothing inappropriate. It's all right if you don't have like a completely white background. Like Faris has like a perfect background now, but that's okay if you don't have that. If you look at Muskaan's, even though there's some color in it, that's absolutely fine, just as long as it's clean. Shut windows and doors, minimize background noise. Make sure that your family know that you have an interview. There's like sort of no movement in the back, no clutter, everything that might throw you off, as well as it will distract the interviewer. They might not listen to what you're saying. They might be listening to your parents having an argument or something. And dentistry is a clinical degree, so loads of makeup, I don't think that it's appropriate. Just sort of make sure that as well your hair is off your face. That's like something that's quite big. No like big dangly hoop earrings. This is more like for the girls. Just for example, like us in clinics, our hair has to be back, off our face. We can't have any sort of big distracting jewelry, etc. And the last thing would be to make sure that your internet speed is fast enough to avoid like sort of connection errors and stuff, because that could cut into your time, it could throw you off. They might not get the full, they might not get your full answer, which would be really unfortunate for you, and it could mean that you're marked down. But yeah, that's everything I had to say. And I know that Raheem had a question. If you could just repeat it, because I can't find it in the chat. I think it's quite far up.
Not gonna lie, I kind of forgot what I asked.
That's fine.
Okay, it was whether they would prompt you or whether you'd have to speak for 5 minutes straight. Faris said, you can get interviewers that are just really sort of, they make you feel really uncomfortable. They might just sit and stare at you for 5 minutes. When you're finished speaking, they might not say anything. But some interviewers will be really nice. Once you finish speaking, they'll ask you if you're done, and if it's okay to say that you're done. But I think Faris is going to get onto that in the next slide, if I'm right. Yeah.
Yeah, just very quickly, one thing to do with the good lighting. One thing I would personally recommend, again, I know that's like financially it might be difficult for some people, but if you can like buy like a really cheap ring light online from Amazon that you can find them for like £5–10. Ring lights are just a really good way for you to get like some nice artificial light, like even in here, like here we go. So look, this is how it would look without my ring light that I've got on right now, and this is how it is with it on. So it really does make a massive difference when it comes to your lighting. It's very important, and you can invest as much or as little as you want. And yeah,
that's well, I have one. If you have a portable charger, you can get these from Amazon for like I think £3 to £5 if you just plug it in. So
yeah. So just having some artificial lighting can be fantastic just to help you out in the interview. And yeah, I'll just go through this very quickly. So some just general top tips. Think before you speak. I think all three of us, the one thing that we always agree on is make sure that before you say anything, you really do think about it, because people fall into this trap of, oh, I need to show I'm intelligent by answering instantly. You don't show any intelligence by doing that. You're just showing that you're trying to be a quick thinker, and usually you don't come across as very professional. It's better to take a second, breathe, think about the question, and then answer, because you don't want to get halfway through the question and then you start stuttering. You start like the ums and ahs and like, and you need to come across as articulate and professional throughout. Next thing is do not waffle. This is massive. Waffling, again, it's this false like intelligence thing. People think if I say a lot, it will show the interviewer that I know a lot. It doesn't. It just shows the interviewer that you're trying to like, you're kind of grasping at straws, trying to find things that was Siri. You're trying to grasp at straws at things that relate to the topic but don't directly answer the question, so it's not very useful. And the last thing, I think this is a Zahra tip, because I can't write any. I can never really write any tips and stuff like that before interviews. But it's really good to have like something written down related to like your achievements. This isn't something you should be bringing into the interview, just to note, like this isn't bringing it into the interview. We're saying like beforehand, like a day before, a few hours before, whatever, you've written down your achievements, you've memorized them, or you have them at the back of your head, and you can call upon them. This is also really important for panel interviews. One thing I'll add, this is like an extra tip from me. What they do sometimes is they'll pick out things that you put in your personal statement, relate it to a skill. So for example, I talked about like an expedition thing I did in Mongolia. They'll link it to leadership, and then they'll be like, okay, can you tell us about other examples of leadership you showed that aren't on your personal statement? So that's something very important to remember. Like sometimes that can be asked. And the last thing I'll say is do not cheat. So you might think you're smart, you might think I can get away with it, and you might get away with it, but don't do it, because if you get caught, it's game over. And the second thing is, if you're planning to cheat, this dentistry career is not for you. So just don't do it, basically. Quite simple. Cool. So let's go straight into Muskaan's top tips, and take it away, Muskaan.
Yeah, so my first tip is make sure you practice all the different types of questions. Obviously it's online, we don't know, but just, you know, being prepared and practice with your friends and family members. Really research your chosen for universities, their course style, you know, societies that they have. They could potentially ask you, you know, why this university, and you have to, you know, have that knowledge, otherwise you won't be able to communicate that effectively with them. And then, yeah, so Faris has said this many times, do not waffle, be concise and clear, and when you can, try and relate back to dentistry. Have basic awareness of current dental issues, dental terminology and specialities. We'll go over some basic knowledge later on in the slides, but like mentioned before, if you do say something, make sure you know it, because they're professionals, they're professors, they're interviewers, they have all the knowledge, and they could, you know, potentially be the person that's written research papers on that specific topic, so you have to be prepared. And yeah, finally, just be engaging, look presentable, smile, and remember all the online etiquettes that Zahra mentioned previously.
Fantastic. Thank you, Muskaan. And now Zahra's top tips.
Whatever uni you're applying to, make sure you research it, the societies, at what point you get the clinical contact, how the degree structure is, and any sort of interesting modules that you're looking forward to. Make sure you practice. Practice was like my sort of bread and butter when I was applying, and make sure you practice with different people, so friends, family. I know I did it. Me and Faris actually went to the same sixth form, so we actually practiced with each other at one point. Think before you speak, like we already said. And my cheat sheet is not like a cheat sheet that I would have like on. What I mean by a cheat sheet is, before my interviews, obviously it's going to be different for you guys, but when you're getting ready to go into the interview, before you're called in, rather than sort of sitting in silence and staring at all the other candidates, I actually had like a sheet of my achievements, so stuff like Jack Petchey Award, stuff like where I had my work experience, just to avoid my mind going blank when I was in the interview. And obviously when I was in the interview, all the stuff was in my bag and it was put away. But don't have it out with you. Have it, read over it like maybe 20 minutes before your interview. And you don't need to go overboard with dental research. I certainly didn't. But you do need to have some knowledge, which Muskaan will tell you guys. And for a panel style, make sure you know your personal statement inside out. They can ask you about anything. And make sure you smile and show expression. Otherwise, they're just going to get bored, and yeah.
Hi, sorry about that. So thank you very much for that, Zahra and Muskaan. So these are the top tips. Let's now go into a bit of a role play. I'm just keeping track of the time at the moment. We are overrunning by quite a bit. So I'm going to try and get through this quite quickly so you guys can have a bit of a Q&A at the end. So with the role play, this is important to note that not every single university is going to ask you this. That's the same with all like these different questions. Different universities have different styles of questions. Another thing to note is that they won't always be related to dentistry. A lot of people think that with a role play, it means that they're going to have like, oh, this patient has done this, or this patient, you have this patient, so tell us what you do in this situation. You might be given the most random topic, the most random like situation, and you have to like make relationships between the different elements of it and make a conclusion based on, sorry, not make a conclusion, make a conversation through these different scenarios that have been given. A lot of the times you'll be having a paid actor that will be working alongside you, who will be giving you like the prompts when it comes to the role play. You have to bear in mind a role play, it's actually like a role play, so you're talking to the interviewer as if they're the person in that scenario. It's a bit weird, but it's important to develop that skill. And the next thing is to make sure you're empathetic, articulate, polite, and realistic. Realistic is the most important one here, because I feel like a lot of people think that especially when it comes to patient-related stuff, they're going to say, okay, I'm going to give you the best treatment. I'm going to do everything I can, all this. And I think, you know, this is me showing empathy. However, instead, you're just being distrustful because you're not providing the service that you said you were going to provide to the, you're saying that you're going to provide a service that you cannot provide to the patient. And last thing I'd say is some common scenarios are breaking bad news, dealing with a hysterical patient, dealing with an angry patient, dealing with someone that can be quite annoying and pestering, or explaining a difficult concept. So they're the role plays. We're going, let me just check something very quickly. Cool. Yep. So we're going to do this role play very quickly. For this one, I just want to say that I'm going to be the person, I'm going to be the person in the role play, and we'll have one other person in front of me, and we'll do this like a little, it's kind of like acting in a way. So yeah, I'll guide you through it from before we start, like what the main things you need to do and stuff like that. So if anyone wants to do this, please do put it in the chat, because I know a lot of people said that they wanted to go through role plays. So let us know, please. Someone, while we're waiting, someone asked, how will roleplay work in online interviews? As I said, we're not too sure. But what I think is going to happen is it will be something like this, and they will still have like a paid actor, and you can still kind of communicate the different things that you want to like communicate and show your communication skills online. You can still do it. It just might be a bit more like awkward. That's what I'd probably say with regards to this question. Let me just have a look at something. Okay, well, if no one's going to volunteer, that's completely fine. As I said, it's up to you if you want to get involved or not. Oh, here we go. Okay, cool. Let's go ahead. Again, I'm really sorry if I butchered your name. Please tell me how to say it correctly. I think it's Marjana. Sorry.
It's Matsiana, sorry.
Matsiana?
Yeah, that's right.
Okay, fantastic, Matsiana. Cool. So, okay, I'm going to just give it to Alina just because we want to, like, I think you answered the question earlier, just so we make it a bit fairer. But thank you for volunteering. That's absolutely fine. No worries. So yeah, Alina, yeah, let's begin. With this one, we really do need your camera on though, because it's going to be very like, I'm going to really be judging you based on like your expressions, your communication, etc. So if that would be great. All right, if Alina's here.
Yeah, hi.
Hiya. Sorry, let me just get the camera sorted because sometimes it takes some time for it to. Cool. Yep. Okay. Hi, Alina. So let us go ahead. So I'm going to read the scenario to you, and then we'll get into the answer. So the question is, you are leading a team on a group project, and one of the members complains and says they're doing more work than their colleagues in the group. They are threatening to quit the project if you do not act. Resolve the issue. And in this scenario, just so you're aware, I'm the angry member. I'm upset, and you're trying to like calm me down and find out what the problem is.
Yeah. Okay.
Cool. So go ahead.
Okay, so Faris, what's the problem then?
Honestly, I've been working so hard on this. I've been putting so much work. I've been doing all the admin work. I've been doing all like logging all the tasks. I've like done all the mind maps. I'm just getting annoyed. Like this is ridiculous now. Like, what do you expect me to do when you're being such a rubbish leader?
Okay, so what is it that you feel that everybody else isn't going to do more of to make it equal and to take off the workload from you and to put it on our shoulders as well?
I just feel like you guys aren't doing anything at all. Like you're just not doing anything. I'm just sitting here feeling that I'm doing all the work. Like no one else is doing anything. I'm just getting frustrated, all right? Like you need to tell me what the solution is. It's not my job to tell you what to do.
Okay, you know what, Faris? I really didn't know that, so I'm really sorry about that. What I can do is I can take off the workload that you have, like that you've done, and that you'd like someone else to do. So I can distribute that to everybody else on the team who hasn't got much to do. That way, you'll have less to do, and we'll have more to do. Like just to equal it out. Is that okay?
Yeah, that's fine. But what, like, is there any punishment for the people that have not done work, or is it just all on me? Like, do I have to take the responsibility for everything?
As the team leader, I've been overlooking this task, and I've not really noticed anybody not doing their job. I've seen everybody do what they were supposed to do. I'm sorry that you feel that way, that nobody's doing what they were supposed to do. So I'll let them know that, and I'll let them know that they should be doing a bit more just to equal it out on you, if that's all right.
Okay, fine.
Are you okay with that?
Yeah, I'm okay with that. Okay, brilliant, lovely. So that was that. Said,
100% sure?
sorry, say that again.
So you're 100% sure?
I'm 100% sure. That's great.
Okay, that's
Cool.
fine.
So thank you very much for that answer.
Thank you.
Lena. Cool. But I said, guys, like some people were saying, oh, how can you do it online? Well, we just did like an online one just there. It might be a bit more difficult. It might be a bit harder to identify like the different person's characteristics or their traits. However, I can still kind of understand the way that Alina presents herself, the way that she'll deal with a situation like this. Before I hand off to Muskaan to give some feedback, I'm going to give some of my own because I just went through that. The one thing I was trying to emulate is that I'm very rude and I'm not really listening to what you're saying. So I'm just saying, I'm angry. I want you to fix the problem. I even called you a rubbish leader at one point. Obviously, the good thing that you did was you were very understanding. You were very caring when it came to, you know, empathizing with my situation. But the one trap that you didn't fall into, which I was trying to do, was that the good thing that you did that basically was that you stood your ground. So when you did feel like I was getting to a point and I was like, oh, no one's doing anything, what's their punishment? You're like, well, I'm the leader. I have been observing. I don't feel like anyone's done this. However, taking into consideration like my concerns, you're going to do something about it, which I thought was brilliant.
When I did that, I actually felt like I was being quite rude about that instead. But I feel like it's good that I've said that actually now.
Yeah, because at the end of the day, you do want to show that you understand my concerns. However, if I'm being rude to you for like, you're the leader, so it's part of your job obviously to deal with these issues, but you can't tolerate disrespect and a person being, you know, disruptive, because like if I'm a true member of the team, I need to understand that, okay, I'm a bit upset, but I need to move on and, you know, try and get things to improve. The only thing I would have added on potentially is just being like, after I review this, I will communicate this with everyone, like have like a group meeting or something, like give me an actual avenue for the solution, because you just said, oh, I'm going to talk to people, or tell me, okay, we'll have a meeting, or I'll have a look at the rota, or I'll have a look at your job roles, etc. Like little things that you can add into here.
Just be a bit more specific.
Exactly. Specificity is very good with these questions because it shows that you've really considered them and you've really had to think about the role play. So yeah, I'm going to pass this on to Muskaan, but overall very well answered, just have to say that. But yeah, go on, Muskaan.
Yeah, I agree with Faris, very well answered. I would just speak a little bit more slower. It's good that you know, asked what he wants and you really included him. And just, yeah, I think overall was a good answer.
Thank you.
And Zahra, do you have anything to add or not?
I would just say one thing, just make sure you thank him a little bit more at the beginning so he feels valued.
Yeah, so just be like, thank you for telling me about this, because, you know, like obviously it's taken, you know, maybe a significant amount of energy and like confidence for me to come and tell you. And one thing that I think I noted down was you said that everyone else has been doing stuff based on your view. I think that's okay, but some people may interpret that as being slightly rude. Like, don't say, oh, I think everyone's been doing this. Say, oh, I understand that potentially, you know, some people haven't been pulling their weight, but I would try and inquire into this more and make more of an effort to understand these concerns, because again, it can be misinterpreted as being rude. So yeah, just thought I'd let you know that. Cool. Again, some examples you guys can do in your own time. And yeah, this is some knowledge. I'm going to very, very quickly just state some things because I want to get us to the Q&A section at the end, because I know a lot of you guys have like a lot of questions to ask. So I'm actually going to hand this over to Muskaan very quickly so she can do the knowledge part because she's a bit more knowledgeable than I am.
Okay, so yeah, you just need to have basic dental knowledge. So like, what is caries? So caries is basically acid demineralization. That's a key word of tooth tissue. So you could mention enamel and dentine, caused by the action of bacteria on sugars. So basically, when you consume food, you get those sugars, and that bacteria in your mouth acts on it, and it demineralizes the tooth structure. So I don't think you need to know in that much depth, but that's a definition that you guys could use. And what is plaque? So plaque is basically a sticky biofilm that adheres to tooth structure. So that's really important, the word adhere. So it can only be removed by mechanical action. That's why we toothbrush, to remove that mechanically. And it contains a matrix of microorganisms. You don't need to know the specific bacteria. One is strep mutans, but again, that's, you know, too much. What is gum disease? So there are two types. There's gingivitis and periodontitis. They're both inflammatory diseases caused by plaque. So plaque is the main factor that causes them. And the patient can present to you with bleeding gums, swelling, redness, and that's how you see that there's a problem that the patient has, that gum disease upon clinical examination. The differentiating factor though between gingivitis and periodontitis is periodontitis is more severe gum disease and it leads to bone loss. So essentially that's irreversible, whereas gingivitis can be reversed and treated. So once a periodontitis patient, you're always going to be a periodontitis patient. You're always going to be under maintenance. And then there are 3 main types of fillings to be aware of. So the composite, which is your white filling, an amalgam, which is, you know, your mercury, silver, tin alloy, that's being phased out. And also there's another type of filling called GIC, glass ionomers cement, and that's a temporary filling. So it's not as strong as composite and amalgam, but it can be used in between appointments or yeah, so that's, if you guys want to know more, like feel free to message me or Faris or Zahra about it. We've linked our Instagrams at the end if you guys are really interested, but this is like basic knowledge that you guys should have.
Yeah, just to like stress that basic knowledge, as I said before, like the reason I put these knowledge slides in is because a lot of you guys mentioned it in the like questions that you asked, but I also realized that when I was doing my prep, I didn't know any of this stuff. I'm just letting you know, like I didn't know any of it, zero. I didn't even know what caries was. I only found out about caries when I got into first year at dental school. I just called it tooth decay. So that's just something to note. Like everyone's got a different level of intelligence, not intelligence, of understanding. But the way that you present this in the interview is just based on how you answer the question. Like you can like stray away from these topics if you're not very strong on them. However, having a basic understanding is always going to put you in a good spot. And this is like a good little mini cheat sheet kind of the basics that you need to know. And as Muskaan said very kindly, you can send us a DM, or at the end of this session, we're about to finish now actually, you guys can give us like a little Q&A. We're going to do a little Q&A where you guys can ask us questions, etc., etc. Cool. So yeah, so these are some more hot topics. We're not going to go into this now because we've kind of run over. However, you can read these in your own time, and again, you can DM us if you have any questions, and more stuff like this. And also, one last thing I'll just say, just out of all this stuff, make sure you just go over your NHS banding. This is really, really basic, but it's a really good thing for you to just like mention in your interviews. Sometimes when you talk about like NHS versus private, banding is a very important thing to mention in terms of like the cost of things and the treatments that fall under them. And yeah, more stuff. As I said, we've left you guys a lot of knowledge, a lot of content that you guys can look into in your own time. I really hope you found this useful. Here's some useful links as well. As I said, I'm going to be putting this all in the email that I'll send to you guys by Monday roughly, because I have a few technical things to get through. And yeah, and that's about it really. Thank you guys for listening.